What are mechanism, symptoms and diagnosis of Takotsubo syndrome?
Well, Takotsubo is a disease mainly of postmenopausal women. It has been under-recognized and it presents like an acute coronary syndrome, typically like an ST segment elevation myocardial infarction. Patients have dyspnea, chest pain. They may actually come in shock. They may have been resuscitated, so it can be quite dramatic in some patients. And in fact, 1 in 25 dies acutely because of this very problem.
Is Takotsubo syndrome a microvascular acute coronary syndrome, or like acute coronary syndrome?
Yeah, this is what I propose that it is. We have to still prove that, but it must be the microcirculation, because the perfusion is reduced. Also in many imaging perfusion studies this was shown, and it's a prolonged defect, so it must be a prolonged vasoconstriction, and that's why I propose that endothelin, which is a long-acting vasoconstrictor, may be involved and may be elicited by the stress, and so instead of the large coronary arteries being involved, it's the microcirculation, but the consequences can be as bad as with the classical infarction.
How is the long-term outcome, and what is the effect of drugs?
Well, so far we don't know from randomized trials. We saw, however, in our analysis, which is retrospective in nature, and we use propensity analysis to correct for biases as much as possible, that beta blockers don't work. Contrary to intuition, they don't work because probably it's the alpha receptor in the microcirculation that's involved, not the beta receptor. In the long run, it seems that ACE inhibitors seem to be protective in these patients, as in others as well. In the acute setting, if they are really coming in shock, it is difficult. In fact, it can be deleterious to use catecholamines or other inotropes, because it can worsen the situation. And then a mechanical support with ECMO or a impeller pump or some other device might be appropriate.